there is a need for us to transform the current systems that are focused on reacting to disease, in which governments and health systems around the world are spending more than 95% of their budgets just reacting when people get sick, to actually making sure that we are creating ecosystems that foster well-being, quality of life for all. This transformation is only possible if we have a real integration of all of the different sectors of governance and not just focus on hospitals and clinics as we've done for the last 100 years. And when we talk about universal health coverage, making sure that that integration is part of the transformation we are trying to foster in low and middle income countries, instead of exporting from rich countries to poor countries, models that we know are broken, that have led to a rise of the burden of disease, that have led to unsustainable costs in the future. We know that there is tremendous power in technology to foster this transformation, to help countries leapfrog into the future. And in my role as CEO at HealthAI, the global agency for responsible AI and health, we are helping build a global framework for regulatory bodies around the world to be able to create the ecosystem that will allow artificial intelligence-driven technologies to lead to better health for all. On my other role as the president of the Unite Parliamentarians Network, we will be able to continue to foster for global health policies to be more effective, more based on science and data, to drive towards the health outcomes, not just for the few, but for everyone in our community, including those that live in most vulnerable situations, so that we can address the underscoring challenges of poverty, which we know as being the main driver of disease around the world. 2023 has been a very challenging year with all of the conflicts and geopolitical tensions that we have seen arise. And so I would say that being able to have contributed, even if in a small portion, through the Unite Parliamentarians Network for Global Health, to see a final declaration being approved at the United Nations General Assembly at the 3 high-level meetings on tuberculosis, on universal health coverage, and on pandemic prevention, preparedness, and response, were very important moments in our global health history that hopefully will lead the way towards real transformation on the ground. There's a lot of work ahead, no doubt, and we should value the accomplishments we are able to achieve as we get there. An accomplishment for 2023 is, of course, in my role as the CEO of HealthAI, the global agency for responsible AI and health, in which we have presented a new strategy focusing on building the global regulatory framework and network that will help the world embrace and harness the potential of artificial intelligence while keeping citizens safe, focusing once again on health outcomes for all and not just for the few. Well, humanity in 2024, of course, faces the challenge of peace, of achieving peace in a world where it seems like more and more conflicts are arising. At the same time, we also cannot just go from crisis to crisis. And in that sense, 2024 should be a moment at which we are capable of learning the lessons from COVID-19 and the pandemic, and making sure that at the World Health Assembly in May 2024, all governments approve a pandemic accord, an agreement that can make sure that we avoid and prevent the next pandemic. We do not want to be the ones that future generations look upon as the ones that, having gone through a pandemic, failed to prevent the next one. Today we have the science, we have the technology, we have the knowledge of what needs to be done to avoid the next pandemic. It is in our hands. It's on our watch. We cannot fail. And 2024 is going to be a critical moment for us to accomplish this greater mission on behalf of humanity.